Okay, so I hope the slide is visible in the full screen mode. Right, guys? Please write.
Yes, sir, it is visible.
Great. Thank you. Thank you, guys. Thank you. Thank you. Okay. So now, yesterday we have discussed about the types of manuscript, and I believe that was interesting, and you got a lot of new information in yesterday's class about the manuscripts and how exactly you can write, or how exactly you can read, and how exactly you can look up to in your tenure of PhD, or when you are a researcher, or if you are doing a research, how can you publish it, in what kind of what type of manuscript you will be choosing to publish your paper or publish your research, right? To showcase your research in front of everyone, in front of the research community, right? So research community, when I'm talking about, I must mention that when you are publishing a paper, okay guys, when you are publishing a paper, you have to target a lot of people automatically. You are targeting a lot of people automatically, including the top level researchers who are either the Nobel laureates or the professors of the big universities. And then you are targeting all the academicians related to your field, okay, and maybe not related to your field also, but they want to work in your field. Okay, then you are targeting importantly all the researchers, okay, researchers from any background. If they are working on your type of research or similar to your research, then they need some information, then they need some literature, and you are giving them the literature through publishing your research, right? And the most important audience is the students, because nowadays every learning is evidence-based learning, case-based learning. Okay, the books are literally outdated. Okay, books are literally outdated, and people don't need the textbooks for subjects. They either read the online papers from the Wikipedia, or from the the online courses, or the online content they try to access every time. And whenever we are talking about the online content, that should be updated, that should be with the current guidelines, that should be evidence based, right? So if you are working on something, then don't delay the things, and let's publish it, okay, and let's showcase to the world, right? But other than these, other than Nobel laureates, other than professors, other than academicians and the students, there is one more community who look eagerly to your papers, who look eagerly to your research to come out and to read some new updates. Who are them? They are either the patients or patients' relatives, or maybe the person who is suffering. Okay, or maybe someone who wants to read. Okay, that could be anyone, patient, or maybe the caretaker, or patient's party, or anyone. It could be the local audience. Okay, local audience means the patients who are suffering from some other disease, right? Or maybe some other people who are looking for the patients, right? So that's how these things are widespread, and you need to reach many people, many people. So that's why always publishing the paper in the good journal. Why I'm talking about community is, see, why I'm talking about community is because if you are publishing your paper in a good journal, in an Scopus Index journal, or in a journal which is having the good audience, good reachability, good visibility in the market, you will reach more people, you will reach more audience. Okay, if you are publishing in something which is paid, or which do not have the direct access to everyone, instead they have the subscription, or maybe those things are not available openly to everyone, or the people who are just taking the money and publishing anything, certain things are not reaching everyone, or certain things are not reaching many. Okay guys, certain things, or when you're publishing in certain journals, or certain books, or certain online online databases, these things are not reaching everyone, right? So that is very important for you to understand, and check out where you are publishing your manuscript, where you are publishing your research. That's very important. Okay, so that was, one tip before we start today's class, right? So always choose the best journal are which are indexed in the top indexation organizations, or like top indexations. Why we are talking indexation is actually nothing but the organizations which strictly, you know make the journals to follow the ICMJ guidelines, International Council for medical journal editors. Okay, those people made the guidelines, and those guidelines have to be followed by everyone. So the indexation organizations, they make the journals to follow those guidelines, and those guidelines even have nothing importantly except the review process. Okay, every publication, every paper, every research needs the validation. Okay, every research needs the validation, and that validation comes from the review process. And the review process means the independent review process. Suppose, I have written a paper, I have done a research, and I have written a paper, and I have given it to my friend only, right? I have given it to my friend only. So my friend will give the positive response only, right? They will not criticize my research, most probably. Okay, most probably in more of the cases, they will not criticize, or they will criticize to the extent where it will not be accepted at all by them, right? So you have to think of like it should be reviewed independently means by someone who is not related to you directly, who is not knowing you, because when the papers are going for the review process, those are going without your name, without your affiliation, or to the people who do not know you. Okay, nowadays people, the editors or the journals, they ask for the reviewers by the author also, but still, they always prefer that the reviewer is independent, and that has the person has no relationship with you, with the author, or with the team, or with the college. They are not from the same college, because otherwise there are the hidden biases. Okay, there are the hidden biases, and biases means there will be either acceptance or the positive reviews only about that paper or about that research. So that's why we should be careful that we are publishing our research in some journal which are following the indexation. And indexation are, as I told yesterday also, the number one indexation right now is Scopus. Okay, Scopus index journals, and then Web of Science index journals. Okay, and then PubMed index journals. Right now PubMed is also not on the top, because PubMed also has included many journals which are actually PubMed is not very strict with the journals, right? PubMed is just leaving them free hand to publish anything, any kind of sit they usually publish. So PubMed is also not that trustable right now, that in comparison to Web of Science. Web of Science is nothing but Thomson Reuters, and then along with that Scopus. Okay, so always choose your journal when you're publishing a paper which is indexed either in Scopus or PubMed or in Web of Science, right? Then it will be validated perfectly. Then it will take a little time, definitely. It will take a month or 2 months or 3 months in the review process, but you will get the perfect journal, you will get the perfect audience, and you will get the perfect citation. See, if you are, one more very important tip before starting the class: citation. Okay, citation I'm going to take in the last class as well, but still you guys should understand that if you are publishing 100 papers, okay, in the paid journals which are not indexed, or which are either Q4 or Q3, you will not get the citations. Those will be published. Citation comes only when your paper is reaching many people. Okay, citation only comes when your paper is reaching every type of, all type of audiences, including the novel laureates also, including the professors also, all the academicians, associate professor, whoever, all the researchers, all the students. So anyone who is doing the research, they will cite your paper as a current research and current evidence. Okay, that's why you have to search a journal, you have to publish your paper in the good journal, very good journal, where you get the good target of audience. And when you have a larger audience, you get the citations. Okay, that is the utmost point, I'll tell you. That is the utmost point where you have to reach is citation by the publication. If you're not getting citation, it doesn't matter you publish a lot of paper, hundreds of good papers. If you're not publishing a journal which has good visibility, that is waste. Okay, so that is the tip for these two tips you have to remember while you are publishing a paper, that we are going to discuss even the last class. But yeah, okay, so today's class is on the components of a manuscript, right guys? So we have discussed yesterday all the types of manuscript. Okay, I'll ask you one by one, you have to answer. Okay, and then I'll be telling you everything. Then I'll be telling you about everything. So first of all, tell me, let's start with the case report. What are the components you have seen in a case report? Whoever has read the case report, please write what were the components of a case report manuscript or a case report research paper. Please write, guys, please tell. Let me see how much do you know. Okay, abstract. Okay, abstract is everywhere except maybe you know the letter to editor or editorials. Abstract is everywhere in all type of papers, all type of scientific publications. Abstract is there. Okay, yeah, abstract, introduction or background or and case report. Okay, introduction, case presentation, discussion, yes. Objective and data. Okay, case presentation, subjective data, introduction, disease condition, abstract, introduction, case report, discussion, conclusion. Okay, perfect, 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 perfect. Okay, so I got it. I mean, you are absolutely right. In the case report, first it would be either abstract or summary. That must be written at the end. Okay, but first you will see an abstract or a summary. Okay, an abstract or a summary. Then the case report will start with a brief introduction or background. Okay, introduction or background is same thing when you are writing any paper. Then you will go to the case presentation or case report, whatever you say. Case report is the entire manuscript. Okay, so case presentation. In the case presentation, you will be seeing a lot of things. You will be seeing first presentation of the case, then you know, you'll be seeing diagnosis, you will be seeing treatment, you will be seeing outcomes, you will be seeing final discharge, everything. Okay, differential diagnosis. There are multiple things what you will be seeing in a case, right? And then after the case presentation, you will go to the discussion directly, and after discussion, you will get the conclusion. Okay, conclusion or the key home message. Okay, usually in the cases that is key home message. Okay, that is in the key home message. There is no results in case, Ankita, no results. You don't need the results in case at all. Okay, we don't need the cases. Okay, case, I mean, we don't need the results because we are not analyzing anything here. Okay, we are not having the analytical software, not using the statistics here. Okay, so we don't need the results in case report. We just need one abstract or the summary, then introduction or background, or introduction and background also, anything you can write. Okay, and then the case presentation, then the discussion, and then the conclusion, a bit conclusion, or maybe directly you can write the key messages and then the bibliography. Okay, that's about the case. Now tell me, whatever you see in a review paper, what do you see in the review paper? Normal review, either narrative or overview, not the systematic review. Okay, tell me, what do you see exactly in the review paper, guys? Okay, yes, please tell me. Abstract is everywhere. Other than abstract, you can write. Okay.
Okay, so firstly, like for example, if they are writing a paper on a disease, okay, first they'll say what is that disease, background of disease with a mechanism, and after that they'll collect few datas of previous 10 or 6 years, you know, before what are the molecules are present, and they analyze and interpret everything. And they'll say like, from the previous work, I have analyzed so and so, and final conclusion every time in review paper they'll be writing like, still the study need to be done. Yes. This is a common what I have observed in all the review paper.
Yes. So that is
sir,
called.
1 minute, sir. May give some inputs to that one review
yes,
paper?
Please, Doctor. Yes, please, Dr. Gopinath. Please go ahead.
Yes. See, the papers are two types as per my knowledge. One is the review paper and research paper.
Yes.
The review paper, when I take up the project work, before go into the bench work, you have to gather all the information. You have to publish it in the form of the review. It is not in the research. It is by getting the information from different sources. These are the views for the project work. And, I don't know.
Hello.
Yes. Please go ahead, Aditya.
So parts review is generally in my context it's divided into just two parts. It's an introduction and the conclusion. The introduction part is where it is subdivided into multiple small subdivisions, which will highlight which is done in the past work.
Okay.
And we compare it with the author of paper, and the present is the current ongoing research, whether it is of our own or it is of some else. But what is the advancement in the technology which helps to further go in and derive a conclusion, taking into consideration so many aspects, and finally conclusion is totally ours, because that review being ours, I would dedicate that conclusion part to be of self. I mean, the author who is writing the review. That's where he will give the core crux of his expertise or his area of expertise. And it will give a totally background of past, present, and future.
Okay. I'm kind of 50% agreed with you and 50% not. I'll explain. Anyone else wants to put the comment? Okay, somehow I was agreed with Dr. Gopinath as well, but only somehow, not 100% as per my expertise and as per I have seen. So anyone else who wants to put on the comment or who wants to write? Okay, introduction, summary, behavior, observation, reference, and examples. Okay. So I don't know what you are talking about observations, but observations usually mean the analysis. Okay, analysis when you are using the statistics. So when I'm talking about review paper, okay, only review, I have mentioned either narrative review or overview, not the systematic review. Now focus, try to understand everyone. When I'm talking about the only review paper, so see, review paper could be definitely, as Dr. Gopinath said, review paper could be the initial work before you jump into the original research. Okay, one aspect where I agreed. The second aspect is review paper is not necessary if you want to do a research or not. Okay, if you just want to read something new, and if you just want to compile the data and publish, that also can be published as a review paper. Okay, so nowadays review paper is a fashion. I will say fashion because that is the most easiest scientific paper. That is the most easiest scientific paper. These are the types of scientific paper only: review paper, original paper, case reports, comment, commentary, summary, or perspective, anything, whatever you are writing. Okay, so that will be one of the easiest scientific paper. So you just have to choose a topic. You just have to come up with a question. Okay, you just have to come up with the gap in science, in the literature, and you have to fill that gap with the data. Okay, that data which is not available in one compiled format. So you just have to go back, you just have to read the review, you just have to read the literature, and you just have to collect the data according to your title, according to your subject, according to your whatever question is. Okay, based on the keywords and all. Search terms will be done tomorrow in the next class, but you have to search the data. You have to get the crisp of every relevant paper. You have to write in your own words, and you can publish it. That is the the crisp method of writing a review paper. Okay, now Aditya, as you told that author has to put his perspective, not at all. In review papers, author cannot write his or her expertise at all. Okay, review papers do not need any kind of new information. You just have to combine the information. You just have to draw the conclusion from that information only. Conclusion means you are concluding or you are drawing a conclusion from the given data, from the given information only. You cannot write your expertise. If you want to write your expertise, go to the systematic review, go to the reports, or go to the letter to editor or editorials. Okay, or maybe commentary, perspective. You can go to that kind of papers. But when I'm talking about the core narrative review and overview, you have to draw the conclusion from the given information only. Okay, so here I was not agreed with you, and in somehow I was not agreed with Dr. Gopinath, where he just told that it is the only work which can be done before starting or jumping into the research. So it can be done at any point of time. Okay, you can do a simple review paper without jumping into any research. Okay, you can address any topic, any gap, any what we say, the firm research background which needs to be addressed and compiled in one format that can be done easily. Now I'll come to the components, as many people has written introduction, background, or many things. Okay, review paper, remember, simple. If you are writing a narrative review, if you are writing an overview, you just need three things. Okay, your entire review paper will be summarized in three things. Okay, three sections. Your entire review paper will be summarized in three sections, and those three sections are: one is introduction, one is body of the paper, and then the conclusion. Or if you don't want to, there is not mandatory to write the conclusion also. You just have to write the conclusion or future perspectives or the future implications. Okay, we call them, we can write, we can end, actually we cannot, I'll not say that we can write, but we can end the review paper with either of these one. Okay, maybe with the conclusion or future implications or just the future considerations. Okay, so conclusion or future consideration means you will be summarizing the entire thing, and then you will be writing the gap even which is left from there. Okay, you have filled one gap in the body, and then you are finding some more things to do in the future that can be written in the future implications or future perspectives. Okay, and you can end your review paper like that. Now I'll come to the body and the introduction in a little brief. I'll be telling in the I'll be showing you the examples as well. But how do we usually start? First, you have to write the introduction. Introduction is nothing but about the background of or background information of the topic or your gap, whatever you are searching for or whatever you are addressing here. Okay, that is your introduction. It includes multiple types that I'm going to tell you. Then after introduction, it will be the entire body. Okay, when I'm talking about body does not mean that specific thing. Body means one or two subheadings. I mean, one or two major headings, 1, 2, 3, 4 major headings, and then subheadings. Okay, like if I'm talking about, suppose I'll show you the example here. Review paper example. Okay, so you can understand here. I mean, no need to go to the slides even. I'll show you here. Yeah, I hope it is visible to all of you guys. Not yet. I have not shared yet. Okay. Okay. Is it visible to you guys?
Yes, sir, it is visible.
Perfect. So, oh, so sorry. I think I did something. Yeah. So see, this review paper I showed you yesterday also. I published multiple review papers, but this is one of my favorite. And I think this is my first review paper, breast cancer and the heart, burden on the chest. So this was nothing like a specific gap, but this was like every information was scattered. Okay, every information was scattered. There were multiple research papers where they have proved, that breast cancer therapies, breast cancer management, if impact a lot on the heart. It has a big impact on the heart. If I'm talking about breast cancer radiotherapy, Okay, radiotherapy impacts the cardiac muscles and it can lead to arrhythmias, it can lead to heart attack. Hormonal therapy also impacts the biomarkers, and it can also lead to heart attack, okay, or arrhythmias. And directly the chemotherapy has the cardiotoxicity. Okay, chemotherapy is inducing the cardiotoxicity. Directly these drugs have major cardiotoxicity, right? So when I'm talking about these different things, someone was talking about cardiotoxicity, someone was talking about fluoxetine induced cardiotoxicity, someone was talking about 5-fluorouracil induced, someone was talking about something else. Different drugs were shown their toxicity, and every drug has a well proven clinical research, or the, like what we say, the clinical trials or the cohort studies. I mean, that information was very much scattered. Okay, that information was not compiled, right? Or radiotherapies at different frequencies, they have shown different types of side effects on the heart. Okay, hormonal therapy has showed some different type of side effect on the heart, but that information was not collected, right? So what we did, like when we wrote the review paper, I think that is one of the best work I did. Literally, why I'm telling is because that was very because it was my first review paper. So it was very much I have given a lot of dedication. It was with very much enthusiasm I did. So I'll really I'll tell you how did it worked. We did not directly jump to the writing part. Right, guys, you have to listen it very carefully what I'm talking. And if you follow these things, I believe that you will come up with a wonderful review paper. First of all, you have to find that gap. Okay, here there is nothing like gap, but the gap what I'm talking about is compilation of the information was not available on the cancer management and cancer therapy, or the breast cancer therapy induced cardiac problems. Okay, that is my gap, that is my exact problem. That was my question. Okay, and there was no compiled information available. So I got my gap, that I can compile this information and publish as a review paper, right? So once I got my question, I directly did not jump into this. First I thought, what are the cancer management? I mean, what are the breast cancer managements? What kind of things are there in breast cancer management? First of all, you will be thinking about, like, okay, there is chemotherapy, then there is radiotherapy, there is hormonal therapy, there is breast cancer surgeries, right? These are the 4 major managements of the breast cancer. Now I thought of, like, what are the drugs and how did they impact the cardiac problems, and what are the major cardiac problems happening by the cancer drugs or chemotherapy and all. So I took some specific key terms, I searched the literature, and based on that literature, then I started writing. So before even starting searching for the literature or going to the literature review perfectly, I made an outline. Okay, so your thing, what I'm telling is, first come up with the gap or the research question, and then come up with a proper outline, what exactly you are looking for. I mean, outline means you definitely go for the literature, like to search the different vague things. Okay, cardiac induced problem, I mean, the chemotherapy induced problems, these. And once you come up with the outline, search some good keywords, and then now perform the literature search or the literature review with those keywords perfectly. Okay, gather the information and just read and write according to your outline. Understand? Outline. So outline is very important, and in review papers there is nothing like specific outline. One is the introduction, then the major body. In major body you have to keep the data in one line. Keep the data means, outline means, in the body you have to keep the topics and subtopics which are connected to each other. Okay, and once you are done with that writing, you have to summarize, you have to end your review paper with either the conclusion or future perspectives or future implications. That's all your review paper needs. Okay, so look at this. Abstract will come after at the end. First is introduction. I wrote about the introduction, like what life is tough after breast cancer in survivors, and then about the problems, about the diagnosis, how it is being diagnosed, what are the factors related to the cancer, what are the therapies related to the cancer, like surgical corrections, chemotherapy, hormonal replacement therapy, radiation therapy in different options, and what are the types of surgeries, and what could be the different things and what you are going to address. Okay, so aim of this overview is to describe the association between breast cancer treatments and related cardiac complications. That is the major question here. Okay, that I'm going to address here. Now I have started with the body means the outline, and major outline here is some good headings and then subheadings. So first heading is radiotherapy induced heart disease. So first I addressed about what are the radiotherapies and how it impacts the heart. So radiotherapy induced heart disease is called as RIHD. It's very much available, and it depends on the number of therapies, number of cycles of radiotherapy, and how the problems are being detected, when it should be monitored, how it should be done perfectly. So I wrote 2-3 paragraphs on radiotherapy induced cardiac diseases. Okay, and then what could be the treatment also of them. Okay, and what could be the complications of that. After that, the second major topic is chemotherapy induced cardiotoxicity. So radiotherapy is not very much, but almost one page I wrote. Then the very important is chemotherapy induced cardiotoxicity. Okay, in chemotherapy, if you see, there are multiple drugs which are rapidly killing the malignant cells, and along with malignant cells, they directly kill other cells as well, right? So I have discussed the chemotherapy induced cardiotoxicity here about almost all the major drugs which causes the cardiotoxicity. First, like type of damage from the cardiotoxicity, then what are the drugs which are causing the cardiotoxicity. Chemotherapy drug like tyrokinase inhibitors, anthracyclines, alkylating agents, or these are causing myocardial dysfunction, left ventricular dysfunction, ischemic problems. 5-fluorouracil and antineoplastic antibiotics are causing causing multiple other things. Okay, and then pericarditis is caused by cyclophosphamide and bleomycin and citrorabine. So these things I have mentioned about one by one, all at which dose, at like if you see here, doxorubicin therapy increases the incidence of congestive heart failure with the higher dose among the patients already on the cardiovascular. So these are the things which are, this is the risk factor which is increased by the doxorubicin. So I stated almost all major chemotherapy induced cardiotoxicity, and then the problems I have addressed here. I thought it is very important to write the treatment also. So as a subheading, I have written treatment strategies for cardiotoxicity induced, cancer treatment induced cardiotoxicity. Okay, chemotherapy induced cardiotoxicity. After that, then the fourth topic is hormonal therapy induced cardiac diseases. Okay, and then breast cancer surgery induced cardiac complications, a little bit about that, and then just conclusion, over. Okay, that's how you can write a review paper. That's very simple. You have to frame. The important task when you're writing a review paper is to frame the outline. Okay, once you are done with the outline, you can go ahead with anything. Okay, up now we were talking about the case reports. Okay, I have mentioned about my case reports yesterday as well. How long should be the review papers? It depends, Ankita. It depends on the journal. Okay, it depends on the journal, like which journal you are targeting. So journals usually give the word limit for the review papers. Usually review papers are from 2,500 words to 5,000 words or 6,000 words. Okay, 2,500 word means 5 pages. Okay, 5 pages times Roman 1.5 space. That's very much very good, and we usually use that only. Times Roman 1.5 the line space, and one page usually have 450 words to 500 words, and when I'm talking about 2,500 words means 5 pages. Okay, and when I'm talking about 5,000 words means 10 pages. 10 pages is too much. See, look at my paper. It is having just, see, one page. Half page is about abstract and correspondence and all. Half page about this, and then page number 2, page number 3. In 3 pages, the entire paper is written in 3 pages. Okay, when they are summarizing, usually in the Word file it was 5 pages, and it has come to 3 pages, and it is, I think, this is the perfect size of a review paper. We are talking about narrative review. Okay, when we are talking about systematic review, it can go up to 15 pages, 20 pages also, or 10 pages also. But this is the what we say the ideal size, like 3 to 5 pages for a review paper in the printed form. In the printed form, it must be 3 to 5 pages, not longer than 5 pages, not lesser than 2.5 or 3 pages. Okay. Right, now I'll come to the case report. So if you look at the case report again, you can see here that first thing here is the abstract summary. Okay, first thing here is summary. Okay, this is the summary. Summary means the abstract. So British Medical Journal, they don't write abstract, they write summary. So here they don't need the because this is a case report, they don't need any kind of background or introduction in the summary or abstract. You can directly just write about the case and how did you treat it and what was the outcome, right? And what you exactly want to show in the case. So you just write in the summary a little bit, that is just 150 words. Okay, in British Medical Journal, you just have to write everything within 150 words, the summary, and then the entire case report. So as you can see here, okay, as you can see here, look at this, what I have, there is the format. I love British Medical Journal for case reports because they have very stringent, very strict, very strict format. You have to follow it. Okay, they tell that you don't have to write the case report. Okay, usually people write, herpes simplex dermatitis induced endophthalmitis, a case report. Okay, you don't have to write a case report. That is already a case report. That is already the journal of the case reports. Okay, you are publishing in the journal of case report, so you don't have to write the case report in the title. Very strict. Okay, strictly, and only the 4 people, only 4 authors could be there in the in the case report. Okay, only 4 authors are allowed in the case report. They feel like, in one case, how many people will work on? No one, right? Literally 1 or 2 people, maximum 3 people. And that's why they give the task to 4 people. Okay, more than 4 authors are not allowed in the case report. Okay, after that, see little bit about the background information. Okay, little bit about the background. They give strictly 100 to 150 words of background, and then the entire case presentation. Okay, after the introduction or background, you can say it introduction, you can say it background, you can say it introduction and background, anything you can say it. Okay, so after introduction, you will go to the case presentation. So here, case presentation, when you are writing, there are specific components in the case presentation. See, majorly the if you see that at the case report, there will be summary first, and summary or abstract, and then introduction, then case presentation, then discussion, then conclusion. Okay, conclusion or key messages, and then you can end it. But when I talk especially about case presentation, how you should write about the case presentation. So case presentation is very important in a case report, right? Case presentation is very important part in a case report because that should have one or some few specific components. When I'm talking about a case, there must be the presentation of that case, how the patient reached the hospital, either through the OPD, through the IPD, or through the emergency ward, or through the emergency room ER, or through anything, or the casualty, how the patient reached to the hospital, and what was the presentation. Presentation means sign and symptoms. Okay, sign and symptoms. Then based on that, we will go to the provisional diagnosis, and then we will go to the original entire diagnostic procedures, whether these are laboratory investigations, those are radiological investigations, those are ultrasound, those are anything, biomarkers, whatever is there. Okay, you will go to the investigations, and based on the investigations, what are the treatment given. Okay, what are the treatment given, and then along with that, what could be the other differential diagnosis. Okay, that you must mention, like how did you conclude the final diagnosis, right? How did you rule out the other differential diagnosis? And after that, you will be going to the outcomes of that therapy or outcomes of that case. Outcome means if the case survived, or if the case got discharged or died in the hospital, what were the complications due to the case has died, right? So that would be the perfect case presentation when you are talking about everything step by step. Okay, everything step by step and connecting all the dots together. That's how you should write the case presentation. Okay, and then the discussion. Discussion means you are talking about all the observations of your case, and you are justifying with the published cases or published studies. Okay, and then conclusion, and then you will directly jump to the bibliography. So look at this background case presentation. First, the case presentation, like the presentation, how he has presented, the patient has presented to the OPD and admitted, and then what were the investigations we did. Okay, what were the investigations we did, and after investigations, what was the differential diagnosis, how we could rule out the other diagnosis. Okay, and after diagnosis, what is the treatment pattern, and after treatment, what is the outcome and follow-up of the case. Okay, this is the entire case presentation. Okay, and then after that, discussion. Okay, after that, discussion, right? So you can see this is there is a huge discussion about that, and after the discussion point, after the discussion, there is no conclusion. Okay, only the learning points, only the learning points from the case, because case usually does not have the conclusion. Literally, if I tell you, case usually does not have the conclusion. Case is having the learning points. What are the points you should learn and apply in the clinical scenarios? Usually when you have the analysis, when you have the statistics, when you have the typical cases and p-values and significance, then you draw the conclusions. Okay, in case reports, you don't draw the conclusions, you don't draw the conclusions. Okay, so learning points, and then definitely these are the things, compare competing interest or patient consent obtained or not. It is very important. See, in the case reports or case presentations or case series, you need the patient consent or the consent from a legal guardian if the patient is not able to give the consent. Okay, that is must. That is must. You have to submit the consent form with the case report. You don't need the ethical approval in case of case reports. In case of case series, you don't need the ethical approval. You just need is the patient consent. Okay, that's very important. And then you can just finish it with the references. Okay, so that's how you write the normal case report. Now I'll come to one of the other case report. What I told about yesterday is the global health. Okay, global health. So global health case reports are these are not being published by every journal. Only 1 or 2 journals in internationally they publish the global health case reports. Okay, so I published one case again in the British Medical Journal, global health type of case report. Okay, so this is like a simple case report, as I showed you previous one. First you have to write about the case entire, and then you have to write the implications, guidelines, how to tackle it, how it is a global scenario, and what is happening in the global scenario, what are the guidelines, what should your country should do. I mean, what should your country do, what should other countries do, what should be the guidelines internationally by UN or anything, what are the bodies which are looking, CDC, UN or anything. Okay, so you have to write about the guidelines, you have to address the issue globally. Okay, so an infant with congenital rubella syndrome in developing India. So how developing India is being impacted by the congenital rubella syndrome, that was addressed with a case. So that means I am addressing the global issue with just a case. So that is a case report which is addressing the global health. Okay, so look at this. First summary, similarly 150 pages because this is BMJ and only 4 authors. Okay, then the case presentation. Okay, the entire case presentation you can see here in the same format. First the case presentation, and then the diagnosis, top diagnosis, and then about the entire diagnosis. After diagnosis, what was the treatment. Okay, and then treatment. After treatment, I started on the antibiotics. After treatment, what was the outcome. Okay, what was the outcome. So see, the patient is currently on follow-ups and is clinically fine, pH has subsided. So what are the outcomes. So here you don't need to write the sections differently. Okay, here you just have to summarize the sections in one format, one paragraph. Paragraph means the longer paragraph, maybe 1 page, 2 pages, doesn't matter, but entire case presentation you have to write, and then you will come to solve the problem in 5 to 6 questions, or those 5 to 6 questions are given by the journal only. Okay, journal has mentioned these 5 questions. You have to address those questions. First is prevalence and diagnosis of the disease you are addressing. So prevalence and diagnosis of the disease in general population, and then morbidity and mortality due to congenital and due to the disease, whatever you are addressing, then economic burden of the disease, then vaccination program or whatever are the management programs in your country and internationally. Okay, what are the programs going on for prevention, and what are the roles of government internationally and nationally to prevent and management, or to prevent and manage the certain disease. So first problem I addressed, prevalence and diagnosis, then morbidity and mortality related to the congenital rubella syndrome, then economic burden of the disease. You can say about the World Health Report or World WHO reports and all. Then vaccinations in the pregnant women, infant against congenital rubella syndrome, and then prevention of rubella infections in pregnant women, then role of governments in prevention and vaccination. So here I have to start from the local. So when I'm talking about local means Karnataka. So Union Health Ministry of India launched the vaccination campaign against the measles rubella in 5 states, including Karnataka. Okay, then campaign goes over nearly 36 million children in the states, but the campaign has whatever are the things, has target of 410 million children. Okay, so you have to write about that. Then you can just write the learning points, what we call conclusion usually, and then you can done with the things. So guardian consent or the patient consent or the legal guardian consent is very much important here. Okay, so that's how you usually write the case reports. Okay, now let's go back to the slides, and let's discuss the slides, and then we'll come back to the original papers or the things. Okay. Okay, can someone confirm this if it is visible, guys? Okay, so what are the components of a manuscript usually? Okay, so here, components of a research article. Research article means the original article. Okay, usually see, there is not there is nothing major which is different in different types of manuscripts, but there is something which is very common, and that is abstract. Abstract is usually common in all type of research papers, like either is a case report, or maybe it is an original article, or maybe the review article. Okay, but there are certain different methods to write the abstract, certain different guidelines which are given by the journals to write the abstract. I'm talking about the abstract. So there are some fun tips about the abstract, writing about the abstract. See, abstract is the extract. Okay, abstract is the extract of the manuscript, extract of the paper. Okay, so you are extracting the entire paper, entire manuscript, entire research in just 150 to 200 words, or maybe 300 words. It depends on the journal, how much words, how much word count they are asking for abstract. Usually 150 to 200, okay, or 250. So you have to concise the entire research in those 250 words. So people do that mistake commonly, that they just copy paste the things from the paper and make the abstract. That should not be done, because you have to write the summary of the entire paper. Okay, summary means it should be written, not the copy pasted from the paper. Okay, definitely this is the part of the paper only, this has come from the paper only, but this should be drawn from the entire paper, not the copy pasted. So things is like, if you are writing the abstract by yourself, if you are summarizing the things, then you will be summarizing in a sequence in the same sequence you have written the paper, right? Like the first introduction, then the methodology maybe, and like how did you do the research, and then the results, and the discussion part. Okay, and then the conclusion. So when I'm talking about this abstract, there are two types of abstract usually considered in all the journals. One is either structured and one is non-structured. Okay, either structured or non-structured. So when I'm talking about the structured abstract, that means it should follow the IMRAD guidelines. Okay, IMRAD guidelines actually. IMRAD guidelines are for the paper and IMRAD guidelines are for the abstracts. Okay, IMRAD or IMRAC Okay, so IMRAD is for the papers, IMRAD guidelines. IMRAD guidelines means the original papers. This is about only original papers. So original papers should be written in IMRAD. So I means introduction, M means methodology, and R means results, and then discussion. IMRAD. A means end. Okay, A is nothing but IMRAD means IMR and D, IMRAD. Okay, so D means discussion. That's all about the original paper. Okay, now the abstract, when I'm talking about structured abstract, that means the abstract should be divided into the 4 sections. First is introduction, second is methodology, third is your results, and 4 is your conclusion. You cannot write the discussion in abstract. Okay, always just avoid the discussion in abstract. No need to write the discussion part in abstract. Okay, just write the results and conclusion. Okay, that's all about the structured abstract. So you have to define the sections differently, separately. Okay, now what is unstructured abstract? Unstructured abstract is nothing, just remove the headings, remove the introduction heading, remove the results heading, remove the methodology heading, remove the discussion heading, conclusion heading, whatever is there, and compile in one paragraph. Compile everything in one paragraph. That's all. Just remove the headings. That is unstructured. Means there is no visible structure. There are no visible sections. So people are scared when it is like, oh, unstructured abstract is what? Structured abstract is what? Nothing. When you are writing a paper, you are writing definitely in the sequence. You are writing definitely with the sections. If you're writing an original manuscript, first you are writing introduction, right? Then you are writing the methodology. Then you are writing the results. Then you are writing the discussion. And that's all you have to summarize in the abstract in the same sections. Done. Okay, and if they are asking for unstructured abstract, just remove the headings. Introduction, remove. Written introduction, remove. Written methodology, remove. Written results, remove. Written conclusion, remove. Compile all the text, and it is your unstructured abstract. Done. Okay, that's how we write the structured and unstructured. What is the benefit of structured abstract, guys? The benefit of structured abstract is that you have a sequence in your mind. Okay, so always write, always, if the journal is asking structured or in unstructured, just write the abstract in a structured way, so you will get the sequence, correct sequence. And if you have to submit in the unstructured way, then just remove the headings, make one paragraph and submit. That will connect the dots, that will exactly address the problems in a sequence, address the sections in a sequence. Okay, that's the major how to tricks how to write the abstract. Then it comes about the introduction when it is an original paper. So introduction is nothing but I think I have told previously or not maybe, but let's think. Usually people what they do is they write a lot in the introduction, 1 page, 2 page, 1.5 page. Okay, but introduction in my thing, and with the guidelines also, if you read the top papers, journals, and papers from the top journals, you will see introduction is just a half page or less than half page. Okay, introduction means just half page. If I'm talking about introduction, that will introduce only a few sections, only a few things about your data, about your entire research. Okay, you cannot write the whole discussion and whole literature of review in the introduction, not at all. Okay, that is, you are not engaging the audience. Audience is not there to read the introduction or literature. Okay, introduction, audience is not there to read the literature at all. No, you just have to write very concisely the very relevant points, which is which must be addressed here. Otherwise, no, half page of the introduction is more than enough. Whenever you are writing any kind of original paper or review paper or systematic review, just half page of the introduction is enough. Okay, now I'll tell you what must be there in the introduction. Okay, introduction must be divided into 3 sections. when I'm talking about introduction, half page also, that half page also must be divided into 3 sections. I mean, 3 small paragraphs. You can compile it and make 1 paragraph also, but 3 sections in your mind, in your brain, there should be 3 sections always. First, if I'm talking about a disease, about a problem, about a procedure, I have to write about that in 1 or 2 or 3 lines. Okay, 1 or 2 or 3 lines, 20% of the introduction, I'll be writing the background of the problem. Okay, like if I'm talking about heart failure, I'll write what is heart failure, how it occurs. Okay, and if I'm talking about prognosis, what is the prognosis? If I'm talking about diagnosis, what's the diagnosis? Just 2 or 3 lines maximum. Okay, 50 words, 100 words maximum. Then the second section will be, I mean, in the first section only, that of the background and magnitude. Okay, magnitude of the problem. Magnitude is what? Magnitude means the prevalence or incidences, or how it is appearing. What is the exact magnitude of the problem, the impact on the society, or impact on the people, impact on the community, that you have to write in the magnitude. Okay, so like, how do you start the magnitude also? I'll just dissect the entire introduction for you guys, so you will just think of and write it off in one go. Okay, so when I'm talking about magnitude, it should start from the local, or it should start either start from the starting or from the back. But I'm just talking about one section, that is magnitude. Okay, so either start from the local, like what's happening at your place, what's happening in your state, what's happening in your country, and then what's happening globally. Magnitude. Okay, magnitude could be either prevalence, incidences, financial burden, economical burden of the disease, anything, or you can compile everything also. Okay, that should be nationally and internationally, local, nationally, internationally, or internationally, nationally, and local. Just write that. Okay, that's all. So your first section is over. First section could could be compiled in 30 to 40% of the 30% of the entire introduction. Okay, then the second section of the introduction, like the second small paragraph of the introduction, would be what about the gap. Okay, about the gap you are going to fill. What is the justification of your study? Why are you doing? You'll be writing like, okay, if I'm talking about heart failure, then I'll be writing, okay, heart failure is in India, mortality is in hospital, mortality is very high, long-term mortality is very high, long-term follow-up is not available, there are very less studies in this. So I'll be writing the gap, I'll be writing the justification why I am doing this study. Okay, that justification will again get around 50 to 60% of the introduction part. Okay, and then at the end, I'll be writing in just 10% part, or one line. Usually we write 1 line, maximum 2 lines, like how you are going to deliver. This review is talking, or this review is going to discuss about the pathophysiology, about the diagnosis, about this magnitude, and this, and this, done. Or the audience will get these things from the review paper or the original paper, whatever. Introduction could be in the similar format for everything, every type of paper, either that is original paper or review paper or systematic review. You have to dissect your introduction in the very short form in 1 paragraph, half page, and that half page should be dissected in these multiple types. First about the disease, I mean the background, and then magnitude. Magnitude would be internationally, nationally, local, and then the gap of what you are filling, and then how you are doing it. So I hope this 1 paragraph is very much dissected, and you can easily write that 1 paragraph. Okay, then you will go to the body. So see why I have written everything in red, the major things. Okay, major things, because all the things are common. Either you are writing a review paper, or you are writing a case report, or you are writing the original paper. So body is just changed. When it comes to the body of the case report, it will be case presentation. Right after the introduction, it would be case presentation, entire case presentation. You can write the entire case presentation in multiple sections, like investigations, diagnosis, and the first presentation, and then differential diagnosis, treatment, outcomes, anything. That is the body of case report. If I'm talking about body of review paper, I just showed you that would include major headings and then subheadings. That's all. Okay, when I'm talking about the body of a research paper, body of the original research article, that will include these parts. Okay, so if I'm talking about method and material, this is new, okay, in the original article. When I'm talking about results, that is new in the either in the original article or maybe systematic review or meta-analysis, wherever we are applying the statistics. Okay, so remember, methods and material and result and even the discussion, these three things are not needed. These four things are not needed in a review paper. The entire black section here is not needed in a review paper. Okay, but the discussion might be needed in the case report. Strength and discussion, strength and limitations are not needed in the case report as well, along with methods and results. Got it? These are the parts, major parts of an original manuscript. Okay, so methods and material now. I'll come to the methods and material. So methods and material also will be dissected. Okay, will be having multiple sections. When you are writing the methods and material of a manuscript, that will be having multiple sections. You can note down. Okay, you can note down those sections. That would be, first thing will be about the study site, where this studies has happened. Okay, where this study has happened. Like I'm publishing my paper, I'll be writing the tertiary care center. So here also some journals, they take the what we say, the anonymity, and some journals, they want the name of the hospital where the study was done. Usually the major journals, the top journals, they ask the name of the hospital where the study was done. Okay, some local journals, some low journals, they don't want the name of the hospital or name of the community or name of the village or city. They just want it to be the anonymous. Like this study was done in a coastal tertiary care center. Okay, tertiary care center is situated in coastal Karnataka, right? That's all. But if I'm writing a paper in a good journal, then I have to write it was done in the Department of Cardiology, Kasturba Medical College, Manipur. And that is situated in the coastal Karnataka, one state of India. That's how I'll be writing the study site. Then I'll be talking about study duration. What was the study duration? 6 months, 1 month, 1 year, 3 year. How much time I took to recruit the patients, then how much time I followed the patients. You know, certain things you have to write in the study duration. Then the major section comes as population. Study population. Study population means what type of population you have included in your study, what type of population you have excluded from the study. So inclusion and exclusion criteria. Okay, so guys, this is, I'm giving the example of clinical site, but this applies everywhere. If you are applying in the animal studies, genetic studies, any kind of basic science studies, you have to give the inclusion and exclusion criteria, right? You have to give the inclusion and exclusion criteria. What kind of tissues you are taking, what kind of tissues you are not taking, what kind of tissues are feasible, what kind of tissues are not feasible, what kind of animals are you are taking, what kind of animals are usable in this kind of studies. So everything will come under the population. Okay, if you are not connecting with that, I am connecting it with, it is applicable for all type of original research. Okay, inclusion and exclusion criteria. Study site, definitely, like which laboratory it was done, which laboratory you use that, right? So multiple things. So first, study site, study duration, everyone has to write. Study population, everyone has to write inclusion and exclusion criteria. Then the fourth and most thing is, if you have any kind of intervention, like if it is a clinical trial, if it is a randomized control trial, or if it is a cohort study with, cohort studies are not usually interventional studies, but interventional studies, if it is, then what was the intervention? After the intervention, like whatever intervention it could be, the patient counseling, it could be the drug, it could be the placebo, it could be, any kind of intervention what you are applying, telemedicine, whatever intervention you are, exercise, yoga, anything, whatever you are applying, the intervention. Okay, and into the animals also, what kind of intervention you're applying, fat diet, or the treadmill of the treadmill for the mouse, or whatever you are applying to the whatever intervention you are putting in your study. That would be the the next section in the study material and methods. After that, what are the parameters you are going to observe? right? What are the parameters? Like I'm taking demographics, I'm taking anthropometric details, I'm taking the investigational details, laboratory details, histopathology, and about the medications, medical history, everything you have to mention in the data or parameters you are going to observe. And then at the end, there are two very important sections of that. One is ethical considerations. In the material and methods only, ethical consideration is very important. From which ethical committee you took, and when did you take the ethical approval, and what is the ethical approval number? You have to mention everything. Okay. And if it's a clinical trial, did you take the CTRI in India? Did you take the CTRI approval? Do you have the CTRI number or not? Or if it is an international clinical trial, do you have the NIH number? Okay, so NIH number is again the clinical trial number. Okay, so you have those number, NCT number, if you have NRT number, if you have anything. Okay, if you have the national clinical trial number, NCT number, then it is most important to write, mention in that. It will give the weightage to your study. Okay, and then the last section of method and material is nothing but statistical analysis or statistical tests applied. So what type of test you are applying to analyze your data, or what type of statistical tests you are applying to analyze your components to give the results, to get the results and the important observations. You have to write about everything. Which software did you use? Did you use SPSS? Which version did you use? Everything you have to mention in that. Okay, and then you have to write the results. Results could be write in the same format as you have written, as as there are the what we say, the aim and objectives in the same sequence. And you can put the tables in those result, and you can put the figures and graphs and flow charts. So make it very easy and representing it in the simple format to the audiences. Okay, that's how we write the results. And then discussion exactly following the results, the same format. Format means the same sequence, like first anthropometric details, maybe the demographic details, then about the first objective, second objective, third objective, fourth objective. Accordingly, you have to write the discussion. Discussion means, as I told every time, it is the justification of your observations, and you are comparing with the published literature. And then after that, if it is an original paper, then strengths of your research, and the limitations of your research. So what are the strengths? Like, okay, I have done this for the first time in India. My registry is one of the largest in India. I am taking the follow-up of 3 years, which has not been done ever in India. Like that, whatever you feel is you are doing it new. You are doing it for the first time. It is giving some important observations. Write those things as in strength. And then what were the limitations? Maybe because of due to the lack of funds, we did not expand this study into multi-centers or multi-centric study, or any limitations, whatever you feel could be written as the limitation. So why it is important to write the strength and limitation? Because it gives the weightage to the manuscript for publication. I mean, you are addressing all the drawbacks also. You are addressing strengths also, you are addressing limitations also, and you are addressing everything neatly and clearly. So there are the high chances of getting published. If you are writing a mess, no one will accept it. If you're writing everything clearly, neatly, connecting to each and every word, each and every sentence, each and every section, it will be published smoothly, guys. Okay, then definitely acknowledgement. You have to give the acknowledgement to the laboratories where you have worked, or anyone who has whom you included, or who has support in statistical analysis, who has support in anyone other than the authors, other than the team. If anyone is there, you have to write in the acknowledgement. Then if you got the funds from anywhere to do the study, then funding resources, authors contributions, and conflict of interest is very important. So conflict of interest is nothing like if you are associated with any company and that study was funded by the company, so the company's funds, whatever you are getting, should not be related to this study, whatever you are publishing, and those funds should not impact the results of the study. Okay, just because the company is paying you, you cannot alter, manipulate, or fabricate the results of the study. Otherwise, that will not be fair with the audience, that will not be fair with the society, that will give the negative results, and that can lead to the devastating, results in the community, right guys? So that's how we should always give the conflict of interest, and then bibliography. So these are the major components of an original article, and you have seen the review article and you have seen the other articles. So I'll just go through abstract. I told you what should be the abstract: background, aims and objectives, whatever is there. So abstract, you should always keep, this is the brief summary of the manuscript. As I told, basic design of the study, major findings in the research, in the results. So that's all, nothing much. Introduction, I already told you. Body, I already told you. Study site, study design, study population, study sample size, if it is there, sample size definitely. Then parameters observed, intervention if anything. Then what are the investigations you did? Statistical analysis means results, discussion, strength and limitations. So these could be the manuscripts, and body of a research review paper is nothing but the major important thing. Okay, so I think that's all about today's class, and let me share with you one more example, one or two examples, so you can understand the things. Okay, this is another review paper what I have published. I think this I have sold.
Small doubt, sir. Can I speak?
Yes, please go ahead, Dr. Gopi.
Regarding the last one, bibliography.
Yes, sir.
I don't know it is correct. Bibliography you have to give to the only arts research work, whereas in the references you have to use for a scientific research work. Is it correct?
I did not get your question, Professor Gopinath. Please repeat it.
No,
sorry.
One of the Viva, one of the experts said almost is having the more very senior member, professor, teacher. And when we write in the thesis book, and the bibliography should not mention for the scientific research work, as a science research work.
Okay.
Like engineering, medicine, pharmacy, and so on. And you have to write the science research work references, and whereas bibliography you have to mention the word bibliography term in case of the arts research work. It is.
Yes, sir. See, that is a totally. I can agree with you, because I'm not sure about that. Literally, I'm not sure about that, because there are two terms when we are talking about references. There are two terms. Bibliography is nothing but the sum of all the references. Okay, where we mention all the references, the entire section is known as bibliography. Okay, entire set, like I'll show here. See, here we also have written the references. Yes. So might be correct, like I'm not sure about that literally. Okay. So you can either write the bibliography here, or you can write the references. We usually write the references only. So okay. So the sum of all the references is nothing but the bibliography. Okay, from where you are citing all the references, you are citing all the papers, that is bibliography. So you can write either the references, or you can give a term of bibliography. That's totally depending on the journal where you are sending it, totally depending on the people, on the person who is writing. So I'm not sure if you can write the bibliography, you should write the references in a specific art, science, or art, or in the science or medicine. But usually we usually write the references only. When we are sending them, we write the references. Either you can write the bibliography or references. I'm not sure about that, but definitely, I mean, it would be the different opinions. I'm not sure about that literally. But this is the sum of all the references, all the things you are citing, that you can write. You can give any term to that. So you can write the references also.
You respond very nicely, sir. That's one you are.
Yeah.
Approaching is a very good.
No problem. So thank you. Okay, so guys, this is the original research work. So first, title, authors, everywhere. Now look at this abstract. Okay, I was talking about the abstract, and abstract. This is the structured abstract. Okay, everyone, structured everywhere. So structure means sections: background, methods, results, and the conclusion. This is structured abstract. Okay. Now I'll show you the unstructured. I mean, this is also structured abstract. But if you remove just these terms, introduction, aims, methodology, and results, and conclusion, if you remove these headings, it will become the unstructured abstract. Okay, it will become the unstructured abstract. That's all. Nothing. There is nothing major to go for. See, introduction. As I told, introduction should be very short, just half of the page, of introduction, and then methodology. Methodology could be in different sections, as you are seeing here in different papers. So you can see here the methodology. okay, about inclusion, case inclusion, exclusion, and then you can directly jump to the results. Results could be in the like in the form of tables, in the form of figures, and then you can go to the discussion part, and then after discussion part you can directly come to the conclusion. Okay, conclusion should be very, very small, 2-3 lines maximum. You should not, as it is very important to write the introduction in a very, very short form, like half page. Conclusion is very important to be written in just 2-3 lines. Okay, just 2-3 lines. Conclusion means the major observations you are addressing. In your words, you are addressing those major observations in the conclusion. Okay, if you are writing a thesis, then the conclusion might be half page. Okay, because you have to write all the negative positive observations. But when you are writing a scientific paper, the conclusion will be highlighting only the major significant observations which are directly addressing your aim and objectives. Understand? Which are directly reflecting or addressing your aim. Only 1 or 2 lines in that. Okay, after that, ethical considerations you can write there also. Financial support, conflict of interest. If you look at this BMJ part, I'll show you here at the end. This is very important to write. Fundings, before fundings, the contributors, like who did what, right? If you see here, concept was decided by Dr. Hasir Karim, Dr. Prasad and Sethi, Dr. Tom Devasya, and literature search was done by all these people, including me, and then data acquisition and statistical analysis, manuscript writing, manuscript editing was done with these, manuscript review was done by all, and who was the guarantor, or guarantor means the director of the study. So those all things will be in that. And then funding agencies, competing interest, nothing was there. Patient consent, if we're obtained or not. Ethical approval, from which ethical approval you took, from which ethical committee you took. Then those things are there additionally. Then your references, and you are done with the original paper also. Okay guys, so that's all for today's class. Now I'll be happy to take your questions. Yes guys, please go ahead with your question. Any questions?
Sir.
Yes.
Hello.
Yes, please tell.
In this total duration of this course, can we get knowledge regarding chapter publications in a book, sir? Can you give us a few points?
That's not included, but
yeah, it's not included.
No problem. I'll take. Don't worry. Additional things I'm happy to take. Don't worry. I'll take about the things as well.
Okay. Thank you, sir.
Popular journals, I will definitely take this class by myself. Now I'll be taking only 2 classes. Rest will be taken by others. And those 2 classes are very, very important. Okay, those 2 classes are very important. One is journal selection and submitting your manuscript. That's very important. That's very, very important. And one more, how to write the original paper. I told you, but still in the details, I'll be telling you how to write the original paper. That I also will tell you in one class, which is day after tomorrow, on the Wednesday. Okay, that I'll take tomorrow. Dr. Siddesh will take on the literature search, literature review. So he will be taking the hands-on practice. He'll be going through. I'll be available in the class. I will be available in the class. Okay, so we'll be discussing and he'll be taking you through how to search the literature in PubMed, how to search the literature from Scopus and Google Scholar and multiple things. Okay, the major hands-on training it is. So you will be learning how to search the perfect literature, guys. Okay, so be available on tomorrow's class. Okay.
Excuse me, sir.
Yes, Aditya.
Sir, you said there is a difference in the structured abstract and the unstructured abstract, right?
Yes.
So the structured and unstructured will be in the abstract itself, right?
Absolutely. Abstract on.
There is nothing to do with the content of the paper. The content follow the same as introduction, body, everything, whether it is structured or unstructured.
Yes.
Irrespective of it. Okay.
Absolutely. Absolutely. And even the abstract content will be similar. Abstracts content will be similar. You just have to write in the sections when they are asking in structured format. When they are asking in unstructured format, just remove the headings. That's all.
Okay, okay, okay.
Yes.
Sir, another one question.
Yes, please, Professor.
Can you explain that one differences between the UGC and PubMed, Scopus, Web of Science, and another one H-Index, and brief clarification on this one. Another one, which one is the major impact factor? Is
Sir,
there in this one course lecture, sir? Is there in the course lecture?
Yes, this is the one class, the entire class, the journal selection. I'll be taking on that. I'll be taking UGC guidelines. I'll be taking UGC list of the journals. I'll be telling you and taking you through online. I'll be opening the UGC guidelines and UGC list in front of you. I'll be taking you through the Scopus, how to search the journal in Scopus, how to search the journal in Web of Science, how to search the journal in PubMed, how to check the H-index, how to check the impact factor, everything. I only will be taking in the last class. Don't worry.
What about another one, open access journals, sir? And
that also I'll take. That also I'll take. That also I'm taking.
The another one, payment journal and free journals.
That also I'll be including in that.
I'm
including all those things in my last class. Journal selection means entire everything will be considered. Everything will be there in the class.
Sir, can you give the dates on which the topics are covered so that we can concentrate more on that?
No, see, this is not fair at all. If you are telling that you will be coming to only, that's not fair at all, because all the classes are very important, and all the authors, these the other speakers, other resource persons are the expert of their subject. If someone is coming and teaching the case report, that must be her forte. If somebody is coming for the review of literature, that must be his or her forte. Okay, maybe I may know lesser than them. So you should be appearing to all the classes. All the classes are very important. The entire, if I'm talking about the research paper publication and research paper writing and publication, the course name include everything, including the research, including the search of literature, including the types of manuscript, including the components of manuscript, including the journal selection, including the submission to the journal, including the referencing style. That is the another class, complete one class. Systematic review writing, review paper writing, original paper writing. That means I'm completing the entire thing. You have to appear for all the classes, okay? And your schedule is there already with you, okay? I'll share again in the, I'll share again. Yes, please go ahead.
Sir, I am Nikhila, sir. Can you please tell me about references? How do we write? Because in particular journals, they are first they are writing the author's name, then they are coming with the name of the reference article.
Okay, let me show you. 1 sec. Give me one minute.
I think two methods are there, sir. One Anchor method, another one is there.
So there are multiple methods, APA methods, MLA methods, Vancouver style, Harvard style, multiple styles are there. There are more than 100 styles, but major are
better, sir? Which one is the prominent one you have to use?
Prominent, there are 4. One is APA, American Psychological Association, and the second one is Vancouver and Harvard, and third one is MLA. Okay, so these 4 methods are very much prominent. Usually the medical journals, when I'm talking about medical journals, they ask in the Vancouver or Harvard style or APA style. So major is Vancouver and APA when it comes to the medical journals or pharmaceutical journals. Okay, so I was talking about this. Guys. See, look at this. Everything is very clearly mentioned about the reference management tools and techniques. All the styles, Vancouver, MLA, APA, and Harvard, all the styles will be taught by the expert. Dr. Pooja will be taking this section. She's expert of Mendeley and Jotero. Okay, so she'll be using those softwares and she'll be telling you in the free softwares, and you'll be learning how to get the references out of the web and how to put the references in the manuscript. Okay, so she will be teaching you all about the reference management. Okay, and I'll be taking the class completely on the journal selection. Not only the journal selection by the name, but journal selection based on the impact factor, based on the site score, based on the H index, based on the history of the journal, everything. Don't worry. Okay, and then I'll be taking this class also, how to write an acceptable manuscript, acceptable original article, on the second day after tomorrow. And tomorrow Dr. Siddesh will take the class, and Monday again Dr. Pooja will take, and Sunday Dr. Okay, so somebody is coming. Okay, somebody is coming from outside.
Sir, another one, sir.
I have
Is it possible to use?
one more question.
Please, no problem. I'm here. Go one by one, please. And I'll be taking the questions from the chat box also. Don't worry. I'll not leave any question. Okay, guys.
Is it possible to give this one material to that one, sir? Because it is a syllabus here there for PG students.
Sir, see, there is nothing in the materials. See, sir, Professor Gopinath, there is nothing in the material. Only I just make 4 or 5
Sir,
slides.
I have only one question. Okay.
Yes, please. Please go ahead.
Hello, sir. I'm Pooja.
Yes, please.
Sir, I didn't understand that one line. Limitation and
Miss Pooja, your voice is not clear. I'm not able to hear you properly. I think nobody is.
Please repeat that. How to write that?
Miss
So
Pooja, we
now
did not.
I'm audible. Hello?
Now you're audible.
Hello?
Now you're. Please tell yes.
Okay. So can you please explain one more time about limitation and strength of the paper?
Sure. Very, 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 very.
How we need to write that by
Yes.
analyzing all the data set.
Absolutely. 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 That I'll discuss. Okay. So when I'm talking about the strength, okay, strength is already there in your justification or novelty of the study, right? Suppose someone has followed the study patients for 1 year before, and you are following for 2 years. That means you are following the patients for longer term, and this you are doing for the first time in your local area or at the national level or international level. Okay, and suppose I'm doing one of the largest study in India. That is my strength. Suppose I am doing some study multicentric. That is my strength. Suppose I am going for the tissue biomarkers instead of only the biochemical biomarkers, biochemical investigations. That is my strength. So whatever I am doing uniquely in my study, or whatever results or observations I am getting, which are unique or which are observed for the first time, those all comes under the strength. Okay, and limitation means there are many limitations. You can find many limitations. If you are doing it single centric, then you can write, due to the less of funds I could not go it multi-centric. Or if you really feel that you left some patients or the follow-up due to the technical errors, due to their loss of follow-up, due to their those things, those limitations, whatever exactly the challenges you faced during the study, those you can write as the limitations of your study, the challenges actually. Okay, so challenges could be written as the limitations, and the positive and unique observations or unique things, whatever you have done, could be written as the strength of the study. Okay.
Okay, sir. Thank you.
But,
yes.
Sir, can you tell me about meta-analysis studies?
Meta-analysis, definitely we are going to take one separate class.
Okay.
Yes, meta-analysis is a separate class. Okay. Okay. So now, I mean, systematic reviews and meta-analysis are there. Okay. Now, I'll anyone else who have the questions? Then I'll go to the chat box. Okay. After Alam is asking, sir, please tell popular journals that I'll take in the class, because that's not a small topic to discuss here. A very nice question from Mr. Mohan. Sir, can a single person write a review article? Very much, very much. You can write the review paper. If you have the patience, definitely you can write the review paper. Only usually the review papers are written by 1 or 2 people only. Others are the guest authors or ghost authors or the respected authors. That's all usually. Okay, or they just, you know, edit the manuscript at the end. That's all. So definitely one person can write the review article, no doubt at all. Journals for review articles. See, journals for review articles are not specific. Okay, usually there are some major publishers like Taylor and Swift, not Taylor and Swift. What's that? Taylor and Francis. Okay, not the Taylor Swift. How it has come to my mind here now. So Taylor and Francis, those journals are usually publishing major journals. Their major journals are focusing on the review papers. Bentham journals are there are major Bentham journals which are publishing the review papers. But all the journals, you know, all the journals which are publishing the original article, they also publish the review papers. Okay, review papers, they are like multifunctional, multidimensional. Okay, they just don't write original papers only. They don't publish only original papers. They publish original papers, case reports, summaries, commentaries, whatever, you know, small reports, full reports, review papers, narrative reviews, systematic reviews, everything. Any journal you search, they publish, because if they are publishing only original papers, their dhanda will band. Okay, they'll not get the business. They'll not get the people to because original research papers, good original research papers are not being done. So they publish all type of research, all type of scientific research. Okay, duration of the review article from start to approval. There is no need of approval for review writing. You don't need ethical approval either for the review article or for the systematic review or for the meta-analysis, because you are not taking the data from any hospital. You are taking the data from online available literature, or which is available in the books or journals. So for review articles, you don't need the approval or permission. Just sit in your house, write that and publish it. No need of taking any approvals. Okay, you need the approvals, ethical approvals for original research. You need the ethical approvals for animal research. You need the patient consent for case series or case reports. Wherever you are involving the case directly from the hospital or the people, then you have to take consent or ethical approval. Okay, if you are just taking from the literature and you are publishing, you don't need any kind of approval. Okay.
Sir, another one question, sir, small question.
Yes, please, Professor Gopinath, please go ahead.
Sir, suppose regarding the citation and impact factor, is it common to the both review article and research article, or generally research article will get this?
No, it's not like that. Not at all. Major citations are coming. If you look at the statistics, Professor Gopinath, major citations are coming from the systematic reviews and meta-analysis and the randomized controlled trials.
And this can, and we can't, review paper should not call that one a research article, sir.
No, review papers are not research articles. Review papers are scientific papers. See, research article means original research papers. Original research has been done. When I'm talking about scientific publication, that includes all type: review papers, systematic reviews, case reports, commentaries, summaries, whatever. Scientific means scientific data. It is coming either directly from the laboratory first hand or second hand from the literature. Scientific literature, that is scientific papers. If I'm telling scientific paper, that includes the review papers and all type of papers. If I'm talking research paper or original research paper, that means that research has been done originally on the patients or on the animals or in the laboratory or anywhere.
Can we broadly classify the type of article? Suppose a research article and scientific article, and a scientific article will come the review article. Am I correct?
No, review article will come under the scientific articles.
Scientific article, okay.
Yes. Scientific paper means the broad term.
Okay.
Scientific articles means the broad term. Everything is based on science here. Yes. Everything, every conclusion, every discussion, every information is being taken from the science or the scientific, that all you are writing is scientific information. Whether you are collecting for the review paper, whether you are writing in the original paper, from the laboratory, from the patients, after the analysis, before the analysis, That all is the scientific information. So broadly, we can say the scientific papers. But when I'm talking about original research paper, that means original research has been done, and review papers are different.
Okay, thank you.
Thank you, sir. Thank you. Okay, even though you mentioned all the components might vary or not, I mean depend upon the specific journal or not. No, not depending on the journals at all. Depending on the manuscript type, depending on the paper type, either it is case report, review article, or systematic review, or original article, whatever. Components are depending on the type of article, not the type of journal. Maybe referencing word limit and number of references would be depending on each journal. Okay, type of citation, that will be depending on the journal, but type of components will not be, or the will not be depending on the journal, will be depending only on the type of article. Okay, yes, Dr. Please go ahead, Dr. Neil. I want to ask something. No. Okay.
No, sir.
Okay. So Mrinal,
Sir,
yes, please go ahead, Pooja.
Sir, can you please explain what is ghost author? Whether they are involved in like I don't know
Okay.
what is that. I heard first
Okay.
time. I don't know.
I'll discuss that. I was supposed to discuss in the journal writing, but let me discuss now. Or let's discuss in the class only, because now almost half of the class is not here. Okay, so everyone must know about that. So I'll tell, ghost authors are the people who have not contributed a word in the manuscript, or who have not contributed in the proofreading, editing, or anywhere in the manuscript or in the paper, and they even don't know what is the title of the manuscript, but their name is there as an author. Those are the ghost authors. Okay, like friends, professors.
Yes, sir. Got it.
Guests.
Friends.
Sir?
Okay.
So, excuse me, sir.
Yes, Aditya.
So, regarding the review articles, most of the journals, whether it is Q1, Q2, or Q3, Q4,
Yes.
most of the journals, they accept only invited reviews, right?
No, who told you? Not at all. Some journals are very specific. You have to avoid such journals which are just looking for the invited articles.
Okay.
That's all. Otherwise, 95% of the journals, they don't look for the invited articles. Not at all.
Okay. Thank you, sir.
Okay, Mrinal has a question, sir. Can you tell us about the tools to write a paper? Human. And then Grammarly to check the grammar. And then maybe you can take the help of AI to search the correct literature. There are multiple tools to help you, but there is nothing which can write the entire paper. AI can write the entire paper, I believe, but believe me or not, nowadays journals have the technique to find out if the paper is written by the human or AI. They, if you go to the plagiarism checker, Turnitin or Authenticate, these two plagiarism checkers are widely used worldwide. If I tell, globally, these two tools are being used, Mrinal. Okay, one is Turnitin. In India, almost all the universities use Turnitin. Okay, and then is Authenticate, and both the tools have come up with AI plagiarism. Specifically, they have added one tool in their plagiarism checker, AI plagiarism. Okay, so if you are writing the paper, they will immediately catch. So best part is writing by a human is the best tool, and definitely you have multiple tools to help you. Like if you sentences are being corrected by Grammarly, you write anything, sentences, complete sentence will be corrected, auto corrected by the Grammarly software. Okay, all the spellings, all the pronunciations, all the the punctuations, everything will be checked and corrected by the Grammarly. Okay, there are multiple software, not only Grammarly, but Grammarly is there, Quillbot is there. I mean, they will help you in writing, but and proofreading, the last proofreading must be done by you, and you have to give a human touch. Okay, then only it will be, I feel, will be publishable. Okay. Ankita, sir, can you give advice on selection of journal? That I'm going to tell.
So what about language editing service? Some journals they are asking. Language.
See, so language editing, frankly, what we write, even I write, they don't understand what I'm writing, because our English is not British English exactly or not US English exactly. We are mixed. Okay, Indians are mixed in English. We are speaking, US and British, both type of English. So when we are mixing that English, they definitely, write at the end, they write a minor comment every time in my papers. They write, please go to the native speaker and correct it. Okay, every time they do that, because my English is either not British or not US, right? So if I'm submitting to the journal, Oxford journals, they ask for corrections. If I'm submitting to any journal which belongs to USA, they ask for corrections. They ask me like, okay, go and check the native speaker and correct it well for the grammar or the sentence corrections. So that's not a problem. You can use any kind of tool like Grammarly and all, they will help you. Or you can give some 500 or 600 rupees for a native proofreader. There are multiple proofreaders, who is good in English or who has done the MA or MBA, MA or some kind of PhD in English. So they are perfectly fine. You can tell them, I want the entire paper proofread in UK English or US English. So they will take, just because they don't have the knowledge of the scientific terms, but they have the knowledge of English. They will correct your English into simple terms.
Can you share the number? Because every time we're facing.
Don't ask me that. No, don't ask me that. I'm so sorry. In author's contribution, what exactly should be right? See, usually major top journals only ask about the author's contribution. Okay, so first of all, let me tell you, according to ICMJE guidelines, you must read, guys. If you are really doing the research, you must read ICMJE guidelines. So ICMJE guidelines says about authorship. They says about who is eligible to become the author. Okay, like as I'm telling, BMJ just consider 4 people. BMJ case report just consider 4 people. Other case reports are publishing 10 authors. Can you please tell me how 10 people will write one case presentation? One line or what? It is just the ghost authorship, it is just the guest authorship, it is just the friendly authorship. Okay, that's why ICMJ comes in the picture. They have the clear-cut guidelines that person who has contributed in either ways in the manuscript writing or manuscript analysis, data analysis, or manuscript proofreading, they will be the author. Even according to ICMJ guidelines, even the person who is collecting the data is not eligible to become the author. Do you know that? The person who is just collecting the data and not included in the planning of research, not included in the writing of the paper, or not included in the writing of the thesis, is not to be considered as an author, because data can be collected by any simple who is not from the science background. So they are not eligible to become the author. Okay, so that is the important thing. When you are writing the paper for a good journal, they ask for the contributors. Okay, author's contribution. In author's contribution, they have 5 to 6 terms, like planning of the research, then guarantor of the research. Guarantor of the research means the PI, principal investigator, and the guide. Okay, those are the guarantor of the research. And then who has analyzed the research, who has written the manuscript, who has proofread the manuscript. So these are the 5-6 criterias. If you have contributed in either 1 or 2 or 3 or 4, anything, but at least one of these 5 criterias, you will be eligible to become the author. So you have to write the contribution. Okay, some journals, they are asking for the contribution of author. So at the end, you have to write like, my name is Ajit Singh. So I don't write at the end, I'll just write AS, and I did planning, proofreading, analysis. Okay, someone else, SH, this. So that's how you write the author's contribution. So everyone must be there in the author's contribution guidelines, whichever given, 5 terms or 5 activities of the paper writing or the research conduction. Okay, if you are included in that, you are becoming the author. You are eligible to become the author. Otherwise, you are not. Okay. Can you guide us on the literature management tomorrow? Literature management tomorrow. Any tools available for grammatical corrections? Grammarly, right? That Grammarly. So can you explain about graphical abstracts? Definitely. I will tell you about the graphical abstracts when I'm talking about, remind me once more, when I'm talking about the original paper writing, I'll tell you about the graphical abstracts, okay? Reference management tomorrow. How to identify predatory journals, last class, what I'm taking. Can zero review or empty reviews? No. What is zero review? I never heard of zero review, Joylin. Could you please explain the dependent and independent variable? You're asking about, you're asking about the biostatistics. I'll explain for you, Mr. Mahesh here, no problem about that. See, dependent variables and independent variables. There are two things. Independent variables are which are not depending on the outcome. Dependent variables are those who are depending or who are directly related to the outcome. Suppose I'm talking about hypertension. Okay, I'm talking about hypertension. So in hypertension, smoking is not the depending factor. Why it is not the depending factor? Because we don't know the, it is there, it is proven that smoking can cause the hypertension. Okay, but when we talk about the salt intake, that is dependent factor. Okay, that is dependent variable because it is directly correlating with the hypertension, because it can influence the potassium and sodium and the electrolyte imbalance. Okay, or maybe if I'm talking about diabetes is not directly relating to hypertension directly. It is the risk factor for hypertension. Diabetes is the risk factor. Smoking is the risk factor for hypertension. But those are the independent factors. Dependent factors means which are directly related to the mechanism or pathophysiology. Okay, or which are directly related to the outcome, directly related. Those are called as dependent variables. Okay, you'll not understand like that, definitely, but I hope somehow I gave you the glimpse.
Just one small reminder, sir. In the
yes, please.
Sir, in the previous class, you told that you will share an article about Picasso's tuberculosis painting.
Yes. Wait, I'll just search and share. After this class, I'll search and share. Okay.
Yes,
I don't have that because I read it only. I read it. Someone showed me that article. Literally, I didn't get it by myself, but I read it somewhere. Somewhere showed me that article. But I'll search and share with you for sure. Okay.
Okay, sir. Okay. Sir.
Yes. Okay. So how? Okay. Aditya is writing, but if I'm not wrong, major journals publish only invited review articles. No. Okay, it's done. Mahesh, development and implementation of the hospital formulary of promoting rational use of influence research study needs ethical, definitely needs the ethical approval. If you are doing it, if you are conducting a research in the hospital, you need the ethical approval. But if you are just writing the review paper or systematic review, then you don't need the ethical approval. Okay. Okay, Joylin is asking, sir, would you please give us information on tools assess of bias? Yes, definitely. Assessment of bias, quality assessment will be given in the upcoming class in the systematic review writing. Definitely. Anirudh asking if minimum and maximum to be reviewed articles to go. I didn't understand, Anirudh. Can you please tell me? Can you please write minimum and maximum? What is that? Chat GPT can be used. Chat GPT can be used. Quillbot can be used. Yes, definitely you can use. Can data generated via chat GPT? Yes, it will be detected. There is the specific machine language. Chat GPT is the machine language, guys. Try to understand. If you are going through the Turnitin, they will directly catch you that this paragraph is written by the chat GPT. Machine language. Human language is completely different from the machine language, and they will catch it. Yeah, that can be detected. Okay, so guys, if no more questions, we can take a break because it's almost 9. 1 hour class has gone up to 2 hours. Thank you very much, everyone. Thank you and take care. We'll see you tomorrow at 7 p.m. I'll be there in the class as well. And if there is something, I'll be also answering your questions, and we all will be discussing again on the review of literature, how to search the literature and hands-on. Okay, thank you very much. Take care, guys. Good night, everyone. Good night.
Thank you.
Thank you.
Thank you very
Good
much.
night, sir.
Take care, guys.
Thank you.